Welcome to another edition of Health Matters, because your health matters to us. My name is Anna Marie Sinatra, and I am part of this wonderful team bringing you some great information. So get your pens and paper ready, because we're here to give you some great news.
Good afternoon. And again, we have a terrific show lined up for you. We're very excited. We're on location, one of the coolest places here in the city health-wise. We're so thrilled. We have two wonderful guests to introduce you to today. Again, please get your pens, paper ready. We've got great information for you.
And see, now Richard is so used to me introducing him, he didn't tell you who he was, but this is one of our corporate sponsors, Richard Blanc from Renovatio Physical Therapy, where you can go not only just to receive physical therapy, but learn about your injury, learn about complementary therapies that can help aid you in your injury. You know, it's going to come across a time in life when you're going to need these services, and this is one of the best places to go.
Why, thank you very much.
You're welcome.
Look how lovely you look.
Thank you, thank you.
Now, where are you getting your hair done?
Well, that's another one of our corporate sponsors, Linda, actually Melinda from Renaissance Salon. She uses all Aveda products. You know, I'm a natural kind of girl. Only natural on my fingers, my hair, my face, and my lips. Everything is natural Aveda products. So thank you, Linda, for taking such good care of me.
Terrific. And how is the talking circuit? I know you're doing a lot of great speeches with your company currently now. Are you keeping yourself very busy?
I am very busy. You know, I love partnering with you to help to take you or your business to the next level. I love, as Richard mentioned, being your keynote speaker or just coming in and dropping, whether it's a 20-minute talk or a 2-day seminar or 1-day seminar. Call me and see what we can do when we partner together.
Terrific. Well, I can't wait. I'm really excited about meeting these guys. Okay, they've been here in Buffalo for a very long time. So why don't we get ready to introduce them?
Absolutely. So, Richard, why don't you introduce our guests?
Well, Anna Marie, I am very, very proud to introduce two of my best friends in the city. These are two partners of Western New York MRI. This is the location that we're at here, downtown Buffalo. Two terrific physicians, both trained here at UB, so homegrown basically. Great practice downtown. To my right, I have Dr. Frank Mascaro.
Hello. Hello.
Welcome.
Welcome to Western New York MRI.
Wonderful. And to your left, we have Dr. Joe Serghany.
Hello, thank you. Welcome here. Thanks for coming to Western New York MRI.
You're very welcome.
Well, I mean, like I said, ladies and gentlemen, they both were trained here locally. They have a wonderful facility downtown. Both out of 9 partners invested in the city of Buffalo. And so they're right here to provide services to all of us.
9 partners, you said.
That's absolutely correct.
Awesome.
So it is a wonderful facility. We're going to be discussing a little bit about some of the services that they provide here and how to help individuals.
You know, Richard, I have to tell you, and I have to tell both the doctors too, I have been a patient here a few times, and my doctor has always said this was the best place to come. So I'm wondering if one of you want to tell us why Western New York MRI on Genesee Street is the best place to come.
First of all, I think we have a convenient location that gives access to all people of Western New York, not only the inner city, but people in the south towns, the north towns, and in the Lancaster-Williamsville area. Also, we have the greatest equipment here, and we've been fully digital for many, many years. So we're kind of ahead of the other areas of imaging that some of our competitors perform at.
Good.
Anything you wanted to add, Doctor?
We have very friendly atmosphere. We have great staff. We give special attention to individuality and patients when they come here. There's no long waiting times. Place is very accommodating and very convenient.
And I can attest to all of that, too. It's kind of funny. You never know what's going to happen, where you're going to be, but it's the truth. And they got good coffee and a lovely waiting room.
And they have several services that they provide here. Not only here, but many locations that they have. They have a second location. How many services total that you guys provide, including this location here?
Well, here at Western New York MRI, we provide MRI services as well as plain film radiography, digital motion X-ray. We also perform CT scans, PET CT scans, and also at our Kenton location, we also provide fluoroscopy and ultrasound examinations.
Wow.
So that's a lot.
exciting.
Now,
Holy
a lot of
cow.
people are going, what?
Oh,
Or
these things.
some people are actually saying, yes, we've been there, we've been to other locations. So make sure you have your pens and papers ready, because today you're going to understand about these machines more. You're going to understand how they can help you, and get real excited about this.
Absolutely. And I am really looking forward to seeing these machines and
Yes.
understanding and finding out not only how they work, and also to find out, the great staff and what they do and as part of the service.
Sounds great.
We wanted to have a closer look at one of the equipment that they use here at Western New York MRI. We are in the X-ray room. Dr. Mascaro, could you explain this machine? It looks just like a robot to me.
Sure, Richard. Actually, this machine is a digital X-ray machine. It's similar to a digital camera that everybody has at home. It's a snap and shoot, and you get to look at the picture real quick. After the technologist sees the picture and deems it to be a good image, it is transferred to our computers where our doctors read the images.
Okay, now, who would need such an X-ray? The physician can refer to you in what capacity?
Well, Richard, if let's take, for instance, if somebody, because it's winter now, and you have a cold or coughing and congestion, you might think you might have a pneumonia, or your doctor might feel that he wants to rule out a pneumonia. You would come here, and we would take 2 views of your chest and make sure that you don't have a pneumonia. And if you did, we would report it immediately to your doctor.
Wonderful. Now, how long does this process take, and does it hurt?
Absolutely not. Doesn't hurt at all. It's painless as anything could be. Actually, it works quite easily. You just stand where the technician would position you, click and shoot, and the images are obtained and sent to the radiologist for interpretation.
Wonderful. Now, how long does the process take?
Probably it would take no more than 5 to 10 minutes. You would be sign in at the front desk, and at that time everything is logged in to the computer. All the patient's information comes to the computer station here at this machine, and the images are obtained and sent into your folder, your individual folder.
One of the things that I noticed when I came through the facility, Dr. Mascaro, is that I see computers everywhere.
Yes, in this day and age, we use computers every day. The old days where films were obtained and placed in jackets and put in storage and lost and put in somebody's trunk, those days are gone. Now everything's stored on computers, instantly accessed by physicians and off-site hospitals. So now information can be shared in an instant to help treat the patient.
Now, I had a question, not specifically to this machine. Why did this group particularly pick downtown Buffalo to put such a magnificent building and all this very expensive equipment in right downtown? And do you feel that it has been beneficial to you in terms of providing services to the community?
Oh, absolutely. We've been downtown, actually. Myself and Dr. Serghany both trained here in Buffalo at UB, and we trained here at Western New York MRI. Also, we have a great presence here in the downtown region at the Sheehan Hospital, at Erie County Medical Center, at the VA Hospital. So we feel that serving the downtown area where there was a void. I mean, there are multiple imaging centers out in the suburbs, but there was nothing for the inner city patient. And not only do we serve the inner city patient, we serve Western New York. And people come from all over to come to our facility.
Now, how far have people traveled to come here?
Actually, we've had somebody come from Nova Scotia, Canada.
Wow,
Yes.
Canadian as well.
Yes.
Okay.
They actually flew into Toronto and drove down to our center, had their MRI, had their results in hand, went back across to Canada, boarded a plane the next day, back to Nova Scotia.
Good. Now, another question, again, outside of the scope of the immediate service that you provide. There are a lot of seniors, a lot of individuals who live in the city and some outside of the city that have really problems in terms of transportation. What can you guys do to help them if they needed this kind of high quality service?
Well, first of all, we offer free van service to people that need transportation to our centers. Also, there is a metro stop right in front of Western New York. So there's different ways that people can come to our facility, and we're here to help them.
Fantastic. This is absolutely fantastic because, I mean, in this area, you have a lot of housing stock in the area, a lot of folks who live very, very close to the center. Do you get a lot of folks immediately close to the center, or is it most of your referrals come throughout Buffalo?
No, we have a good mix. We have quite a few people that are from the inner city and actually very close to our center. We see people, when we say walk-ins, they're actually walk-ins. They walk to the center and have their x-rays performed or MRIs. And we have people that come, like I said, from all aspects and all areas of Western New York.
Wow, I'm really looking forward to sharing the rest of this facility with our viewers. This is absolutely exciting. I mean, I never knew that x-rays were like this. I remember there were those giant plates that you'd go in, and it would be completely magnetized in there.
Mm-hmm.
This is absolutely wonderful, Doctor.
Well, thank you, Richard. I think we work very hard in making our facility patient-friendly. We provide a great service. Our turnaround times for reports to the physicians that refer the patients to us is within 24 hours, absolutely. And if it's something that's need urgently, we do it on the spot.
Well, you know, thank you so much, Dr. Mascaro, for sharing such great information with our viewers. And again, at Health Matters, you know that we're here to find information, great things that are happening in the community, and share it with you. This is our home. Buffalo is our home. This is a great facility downtown. It's right here in the heart of the city, and there's great patients here and working with you. They have a wonderful staff. We've had a great relationship in referring patients here. We've come ourselves and gotten services here. They're absolutely fantastic. So again, we're going to be going through the facility, showing you much more great things that they're doing here as we go forward. I think we'll be talking with Dr. Serghany and maybe sharing some ideas with some of your techs.
Absolutely. There's a few more things that we'd like to show you here at Western New York MRI. And Dr. Serghany will be showing you the digital motion x-ray, and we'll take a look at our MRI facility.
Wonderful.
I'm standing right in the middle of this x-ray machine next to Dr. Serghany, who's going to tell us a little bit about this machine.
And Marie, this is a digital motion x-ray. It's a fluoroscopy unit, but it's a very, very special fluoroscopy unit. It has very low dose radiation because we use it predominantly for the neck to evaluate for ligament injury in the neck, in the vertebrae of the neck or the cervical spine. Quite often, patients get into trauma where they had deceleration, which means they're going fast and they come to a sudden stop where the head is quite heavy and they have the shaking motion of the head. A lot of ligaments could be injured where MRI or CAT scan cannot show the abnormality. And
So then you're saying like a regular CAT scan wouldn't show the ligaments being injured. So a machine, something like this, that maybe you could tell us a little bit what it does, would actually show the ligaments where other machines don't do that.
Exactly. Unless you have a severe life-threatening injury where there's a lot of bleeding around it, an MRI or a CAT scan would not show some of the ligamentous instability that could lead to a lot of pain that's unexplained from the MRI alone or the CT alone. And how that works, that doesn't show you the ligament itself. This is what I explain to the patients every time they come here. Don't expect you're going to see a ligament. We're going to look at your bones and the way the bones articulate. There are ligaments that hold them. There is a certain acceptable range of motion and some unacceptable range of motion if a ligament that's supposed to hold two bones is damaged. So we ask the patient to give us their best range of motion, and as they're moving their neck and we coach them on the different ways they should move their neck, we could tell which ligaments is damaged, and within a couple of hours we issue a report, usually the same day the physician gets a gets a fax copy of that report, and in a few days he gets it in the by mail. And if the physician requests, we make a DVD of the patient's motion and study.
So that's incredible. So then if you're still having pain and you've had some x-rays or CAT scan, you don't know what's going on, you can come and get a x-ray. Is it still called an x-ray with this machine that would give you even more detailed information about everything else going on?
You're exactly right. That's not the first modality of choice. If somebody has pain that's unexplained by the findings on an MRI or a CAT scan or X-rays, then that becomes a great tool in identifying ligament injury that could lead to long-term disability and pain.
Wow, that sounds very important. Tell the listeners once again what the name of this machine is in case their doctor isn't familiar with it or isn't suggesting it, they would know what to ask for, because we want to give you the power to know the right questions to ask.
It's called digital motion X-ray. So it's an X-ray in motion. It's like a video clip where you see the bones moving, and we could tell and make a diagnosis if a ligament is injured. So again, it's digital motion X-ray.
Awesome. Thank you so much, Doctor. So, Dr. Mascaro, tell us what we're looking at now.
Right now we're at the entry of the MRI suite. You're probably looking right at the MRI bed where the patient would lay down, and the patient would be prepped prior to going into the MRI unit. And basically everything is made quite comfortable for the patient. We can put a little air conditioning on, and keeping the patient comfortable and as still as possible is very, very important during this examination.
Thank you. So, Dr. Serghany, tell us what we're looking at here now.
You are looking now at an MRI of the lower spine, which is the lumbar spine, and you're looking at the image to your left is what we call a sagittal image. Same for the image on your in the middle. We look in different ways at the same anatomy, and the image to your to the far right is an axial image which is like a slice, a cross section, and this is just each image is a representative of a series of images we acquire at every level, and we look at every disc up and down, right to left. We look at the sides. We look at the foramina where the nerves exit. We look at the discs, make sure there are no disc herniations, anything that could impinge on the nerve. We look at the bone structure, make sure the bone looks good. We look at the spinal cord, which extends to the upper level of the lumbar spine, beyond which you have a lot of nerve roots.
And so this is really incredible. So people are actually looking at right now somebody's spine, and we're such a blessed country that we have these machines that can tell us, identify what the problem is, so then we can seek the appropriate therapy. So when you're looking at these types of x-rays right here, right now, what are you seeing as the problem?
This patient has disc disease at the two lower levels in the lumbar spine, which are L4 and L5, and between L5 and S1, which is between the lower lumbar vertebra and the sacrum. Those images are just one image from every series, so there are multiple images done at the same level. You scroll through. Those images are of very good quality. We have very high resolution, very high contrast. Of course, with the patient staying or sitting still during the examination makes the examination also better, and we have a very well shimmed magnet or very homogeneous that produces very high quality picture where you could see the muscles well, you could see the bones very well, the discs, and any pathology. Everything depends on what the machine can produce.
And I understand also that you have an open MRI, so people who just saw the machine and see it as being like a little bit of a tunnel effect, you have a facility that has one that's open as well?
That's correct. We have an open MRI at Canton Open MRI in Kenmore, where we also have a CT machine at the same location, X-ray, ultrasound, and fluoroscopy. Few people get intimidated or claustrophobic in an MRI machine, and some of them, you could counsel them, give them some Valium. It works on most of them, but there are still few that still needs an open MRI, where we send them to our other facility.
That's amazing. So we're sitting here in the waiting area after we've toured the entire Western New York MRI facility today, and we're hoping that you've taken lots of notes so that you can get the power to take control of your life, take control of your health. There's so much out there for you folks. There's no need to be in pain. There's no need to wonder what's wrong with your body. We're in an era now where there's just so much to offer you. So we want you to make sure that you take down this number that you're going to be seeing at the bottom of the screen and before and after the program, and get proactive. You know, because you can ask your doctor questions and you could tell him, this is what I saw and this is what I want done. Right, Richard?
Well, absolutely, and that's really the power that we bring you through education and understanding what's available in this great region of ours. Again, if you were studious today, you saw a lot of great mini machines that we showed you. Not only that, but you got to hear from some great minds. These are people who studied here in the region. They could have gone anywhere else in this country to practice. They decided to stay here to take care of you and I. So we're very grateful to them for that. But certainly they took time out today out of their busy schedule to share some information with us. So we're very, very grateful.
And they are going to tell us where all their locations are.
Dr.
Well, today we're here at Western New York MRI, which is at the corner of Genesee and Elm at 222 Genesee. We have a second facility at Kenton Open MRI, that's in Kenmore. We also have another facility at the Westside Urban Medical Facility on Niagara Street. We have nuclear medicine on Humboldt Avenue. We also have X-ray at Elmwood Avenue at the Westside Imaging Center. So we've got a good array of areas that we can provide radiographic imaging for patients. And that's to also include, we're also radiologists at numerous inner city hospitals such as Sheehan Hospital, ECMC, the VA Hospital.
That is absolutely fantastic.
Isn't that amazing?
Yeah, they're covering every corner of the city. That is absolutely
and
fantastic.
you know what that shows? Commitment to the area.
That's exactly
Commitment to
right.
the area.
And that's why I'm excited today, because so many people leave this region. Now we have a chance that we have our own here that are providing care for us.
Absolutely. And Doctor, what would you like to say to encourage our listeners and our viewers today to get proactive in their health and find out what's going on in their bodies so they can have better health too?
Well, I'd like them first to go to their physicians frequently, make sure they do the regular health checkup. There are a lot of screening things that need to occur with women mammography. If you have back pain, don't consider any pain as normal. You should be pain-free. There are a lot of excellent facilities in the city. We're here to serve you, and you could use our expertise. Would like the patients to really take care of their bodies and health. And if they have any problems, do not be shy of telling your doctor that something needs to be addressed. I'd like also to add that we're also in downtown at the Lifetime Health Center at Mosier, a great facility, great accessibility. It provides, as well as Sheehan Hospital, mammography to the inner city patients, so that you don't have to get too far to get what you need. We also have on the same complex at Western New York PET-CT at 700 Michigan, which is the building adjoining to the building we're at right now, where we have one of the most advanced PET-CT scanners in the world.
And speaking of that, we want you to know that we're going to come back here again because there's just too much information here to be able to cover it at one time. So we're going to come back here again. So make sure that you keep an eye on health matters, because your health matters to us. And we are so committed at bringing you powerful information. And we're so grateful to both of these doctors who are committed to this area.
And you know you have the power to make a difference in your health.
So until next time, get proactive, get involved, and we'll be bringing you some more complementary therapies as well as being back here again next month. So stay tuned.